Good afternoon, everyone, and welcome to the third honors convocation of this medical school, but in a way, it's almost like a first honors convocation, and I'll explain. At many commencement exercises in medical schools throughout the United States, honors are given at commencement, and I have sat on the podium of many such exercises, and people are just scrolling through the list of honorees and saying, when are the graduates going to graduate? And it almost separates the achievement of winning an award from the excitement of commencement. So when we were planning this new medical school, we planned from the beginning to separate honors convocation from commencement, but keep them next to one another. So it was always our intention to have an honors convocation the day before commencement. Because after all, some of the people receiving honors are not graduating. We're going to be honoring people from a variety of classes. And that's the reason that this is a very special honors convocation, because it occurs truly the way we planned it the day before commencement. And with that, I will tell you that this is an event meant to recognize excellence. Oakland University William Beaumont School of Medicine is a new school. I will tell you that if you travel in the circles of academic medicine, regionally, nationally, globally, this is a school that is widely recognized for high achievement. Yeah, part of it is due to curriculum, and part of it is due to a wonderful health system with which we are partnered. But in large measure, it's due to the achievement of our students. They're the ones who carry the message out. They're the ones who are evidence that this school is special by virtue of the fact that they are special. So I welcome you to this third and somewhat first honors convocation for the school. And it is my privilege to introduce to you the new president of Oakland University, Dr. George W. Hind.
I'm absolutely thrilled to be here. Tomorrow, this arena will be filled with the most exciting event I think that I've ever had in my academic career, and that is to be the president that is inaugurating launching really the first medical class here at Oakland University. It is extraordinary to think, in fact, that this is the first school of medicine in the state of Michigan in more than 40 years, and there are many distinguishing factors here. And I definitely want to extend all my congratulations to you all, but most certainly to the students that are sitting up here to receive these honors today. The fact that they have persevered, I think, through one of the most rigorous and possibly demanding curricula that we offer in higher education in this country and perhaps the world is an unbelievable accomplishment. Not only have they done that, but they took a chance on a university that had started a medical school and that really had not yet been established in history. And we are really proud of the students here and everything that has been accomplished by our faculty. The fact that these students took a risk and came here and excelled so absolutely extraordinarily, I think brings it really reflects well on their parents, their upbringing, but most certainly their commitment to a curriculum of compassion. And in that sense, I really want to make a few comments about what I believe to be the distinguishing factor of the School of Medicine. And when the students take their oath, the word compassion will certainly be a very important part in that oath. But I think there's something else that's embedded within the notion of a compassionate physician and a compassionate individual, for that matter. And I think that is that if one is compassionate, one has to recognize that one is human. And in that context, I think it's very important to recognize that if one is human and one is compassionate, it's important to understand what underscores a relationship, whether that's relationship with a spouse, a friend, a companion of some kind or another. We can have many different kind of relationships, I think. We can have physical relationships with individuals. We can have an intellectual relationship. But compassion really requires, I think, an emotional connection. And in my view, that is what we have managed to instill in the graduates that we will see here tomorrow, and certainly the students that are here to receive awards today. I think that with the responsibility of being a physician, a practicing professional, comes a responsibility to understand what underscores the compassion that one expects, and certainly one that desires to have from a practicing professional in the health professions. The word, in fact, as we learn a little bit about compassion, we can define it by referring to any dictionary. Compassion is a sympathetic consciousness, as defined by Merriam-Webster, sympathetic consciousness of others' distress, and this is the important point, combined with a desire to alleviate that stress. That really is what I think defines the word compassion. And I think it is impossible to have a relationship, whether it's a physician-patient relationship or a relationship we have with others, without really feeling that emotional connection and that desire to help out, to reach out, to address the things that make that individual unique, but also whether it's a physical challenge or an emotional challenge, to reach out and want to alleviate or to address that. I can say I'm a psychologist by profession, and I know that in the profession of psychology, compassion is absolutely extraordinarily important. The curriculum here, I think, has instilled that in our students, because I think our students have not only mastered a curriculum that I think they would probably claim very strongly was very rigorous, certainly in the basic sciences, but also in the clinical practice, but they've also embarked on, I think, a professional journey. And part of that professional journey is to learn more about oneself here in the William Beaumont School of Medicine. And that personal journey really implies that there will be growth. And these students have done exactly that. They had a starting point when they started the School of Medicine and their program as M1s, and now they're ready to graduate. They have learned probably as much about themselves as they have about the profession of medicine. And I think it's important to understand that that personal growth really underscores what we do here at Oakland University, and in fact all institutions of higher education in this country, is that not only do we want to impart knowledge, that's certainly an important role, but it's also an opportunity for students to learn more about themselves, to learn about their strengths, to learn about their weaknesses. But I think most importantly, it's important that these students have learned what compassion really is in the context of the practice of medicine that they will soon be engaged in as residents, and then certainly as practitioners of the art. So I think when what we know and what we feel collide, I think that's, in fact, I think where things, the nexus really occurs between what our intelligence is telling us, but also what our emotions are telling us. And I think it's important to keep in mind as we move forward, but most importantly as they move forward in their careers, that they will continue to grow and evolve as they learn more about that personal connection, that desire to intervene and alleviate stress and meet the needs of others. I think that's the thing that was probably one of the most important achievements for this medical class. So I want to congratulate all of you for the awards you'll receive today. I want to congratulate all of you for providing the support, and I suspect some of the compassion during the rough periods in this journey that these students have taken. So congratulations to you, and most certainly congratulations to all the students we're going to honor today. So thank you very much.
It's my privilege now to introduce to you Dr. Angela Nazarello, Associate Dean for Student Affairs.
So I have the privilege of starting to give out awards to our students. We will start with the awards for our M1 students first. The award for Outstanding Performance in Anatomical Foundations of Clinical Practice 1 course goes to Paris Vicaria. The award for outstanding performance in Anatomical Foundations of Clinical Practice 2 course. The recipient is Saritza Mendoza. The award for outstanding performance in Art and Practice of Medicine course, funded by Dr. Myron Laban. The recipient is Jordan Berg. The award for outstanding performance in Biomedical Foundations of Clinical Practice 1 course, funded by the DeRoy Foundation. Recipient is Allison Fox. The award for outstanding performance in Biomedical Foundations of Clinical Practice 2 course is Paris Vicaria. The award for outstanding performance in the Cardiology course, funded by the DeRoy Foundation, is Paris Vicaria. The award for outstanding performance in the Neuroscience course, funded by the DeRoy Foundation, is Arminder Kara. The award for outstanding performance in Promotion and Maintenance of Health course, funded by the DeRoy Foundation, is Renee Chalaway. The award for outstanding performance in the Respiratory course, funded by the DeRoy Foundation, is Allison Fox. And now our M2 awards. The award for outstanding performance in the Art and Practice of Medicine course, funded by Dr. Myron Laban, is Woodrow Sams. The award for outstanding performance in the Behavioral Science course, recipient is Joseph Versaloni. The award for outstanding performance in Evidence-Based Medicine course, recipient is Rachel Henke. The award for outstanding performance in the endocrine course is Tori Nault. For outstanding performance in the gastroenterology and hepatology course, the recipient is Rosalind Oakley. The award for outstanding performance in the hematopoietic and lymphoid course is Tori Nault. The award for outstanding performance in the reproductive course, the recipient is James David. The award for outstanding performance in the musculoskeletal course, recipient is Kelsey Setkowiak. The award for outstanding performance in the promotion and maintenance of health course, recipient is Joseph Versaloni. The award for outstanding performance in the psychopathology course is awarded to Rosalind Oakley. The award for outstanding performance in the renal and urinary course is Joseph Versaloni. I would now like to invite my colleague, Dr. Linda Misra, to the podium for the awards for the M3 students.
Good afternoon, everyone. It is my honor to give out the M3 and M4 Clerkship Awards. The award for outstanding performance in a family medicine clerkship is Lucy Buckelhide. The award for outstanding performance on the internal medicine clerkship is Harmel Gill. The award for outstanding performance in the neurology clerkship is Adam Hills. The award for outstanding performance on the obstetrics and gynecology clerkship is Brandon Lujak. The award for outstanding performance in the pediatric clerkship is Alex DePore. The award for outstanding performance in the psychiatry clerkship is Ann Wagner. The award for outstanding performance in the surgery clerkship is Andrew Angus. And now for the M4 Clerkship Awards. The award for outstanding performance in the anesthesia clerkship is Amanda Shee. The award for outstanding performance on the diagnostic medicine clerkship is Jonathan Goike. Jonathan wasn't able to make it today. And lastly, the M4 award for outstanding performance in emergency medicine clerkship is Laura Diffenderfer. It is now my pleasure to introduce the next awardee giver, Kara Sarinsky.
All right, so it is my pleasure to award 2 different batches of awards today, both for the Capstone program. The first set is called the Capstone Dean's Awards, which were awarded last summer to the class of 2016 students who had the top presentations in the Capstone Digital Abstract presentations. So the first place awardee was Amanda Stahl for her project, The Risk Stratification of Pulmonary Embolism in the Emergency Department. There is room for improvement. Second place went to Joseph Versaloni for his project, Measuring the Effectiveness of Peer-Assisted Clinical Skills Training for Medical Students. All right, and third place went to Rachel Hunt for her project Radiation Therapy for Alzheimer's Disease, Influence on Beta Amyloid and Synaptophysin Expression. All right, and the second set of awards is for the Capstone M4 scholarships, which were awarded for outstanding performance in Capstone. The first awardee is Ashley Guthrie for her project Outcomes Following Radiation Therapy versus Minimally Invasive Surgery for Head and Neck Cancer. Adam Hills for quantitative differentiation of lymphoma subtypes through positron emission tomography and CT imaging. Ariel Mintz for resident effects on emergency department patients' satisfaction. Syed Rizvi for clinical outcomes and quality of life of patients with brain metastasis treated with gamma knife stereotactic radiosurgery. Adam Weiner for investigating the relationship between glycated hemoglobin post-operative glycemia and risk for post-operative infection. That's a mouthful. All right. Amanda Shee, for social media policies at U.S. medical schools. That was easier. All right, and the last 2 Capstone M4 scholarships were specifically funded by Ann Nicholson, and they went to Michael Bonnet for medical students' debt's effect on student wellness and career intentions. He was not here to accept. And lastly, Brandon Luchak for arm pain in youth baseball players, a comparison of 2 little leagues.
Thank you.
You're welcome. Congratulations.
The next award is special because of the way that it is given and who nominates and actually determines the award. This is an award given in memory of a beloved colleague, Dr. Michelle Rabel, who was the founding Associate Dean for Education, in other words, curriculum. Michelle came to the school in the late fall of 2008, and only 2 days after we received our notice of preliminary accreditation, Michelle, who was a hematologist and hematopathologist, learned that she had leukemia. And we'll talk a little bit more about Michelle tomorrow at commencement. Her desire during getting her chemo was that she be able to greet the charter class, and sadly, she passed away only about 6 weeks before the charter class arrived. Her husband, Dr. William Miles, was till recently, the clerkship director in psychiatry for this medical school, and Bill was instrumental in establishing an award in memory of Michelle. And I will invite Bill to the podium to explain the nature of the award and how the recipients are chosen.
Thank you, Dr. Feldberg. Good afternoon, everyone. I would like to offer my congratulations to the charter class. I would also like to offer my congratulations to Dr. Feldberg and his team for a job well done, and to personally thank them for their support over the years. As Dr. Feldberg explained, Dr. Michelle Rabel was the founding associate dean for undergraduate medical education here at the Oakland William Beaumont University School of Medicine. She was recruited here by Dr. Feldberg, not only for her expertise in medical education and assessment methodologies, but also because Dr. Feldberg knew her very well on a personal level. He knew that Dr. Rabel's personality and passion for learning would directly impact the culture that he envisioned for this new school. The culture with which the students are now so familiar with is due in no small part to Michelle's influence during the early days of the formation of this school. And as Dr. Feldberg mentioned, Michelle Rabel died on June 21st, 2010, while undergoing treatment for acute myeloid leukemia. While undergoing chemotherapy, she had told me how disappointed she was that she might not ever meet any of the students who were to matriculate into this school. She also told me that she was fearful that her contributions to the formation of this school might be forgotten in the event of her death. I promised her I would not let that happen. I established the Dr. Michelle D. Rabel Fund for Medical Students in her memory. And this endowment is there for the students to enhance their education. In discussing with other founding administrative staff additional ways to ensure Dr. Rabel's legacy, we decided that a student award should be given in Michelle's memory to a first-year student who best personifies the qualities that Dr. Rabel brought to this school. These qualities include a student who is compassionate, a learner and educator, one who cares deeply about others, and who functions as a mentor for everyone he or she meets. This student is one whom all medical students, not just at our school, but everywhere, should want to emulate. This student would be nominated and selected by his or her peers. As I talked to some of the student members of the charter class earlier and some of the other students here today, and I look out among the faces of the faculty members, some here from the very beginning, others added more recently. I can tell you that I think Michelle would be proud of what was accomplished here. As to who will receive the Michelle D. Rabel Award this year, for the first time, we have a tie. 2 students received the same number of votes from their peers. This is obviously a testament to the high quality of student we recruit here. Also, it's a testament to their mentoring by faculty and by more senior students. So the Michelle D. Rabel Award this year goes to 2 students, Renee Chalaway and Eric Raynal.
Thank you, Dr. Miles. At OUWB, there's a sense of community, and actually there's a little logo that we have that represents diversity and inclusion. The word diversity sits atop the word inclusion. It's linked by a capital I to remind us all that I personally am responsible for an environment that embraces diversity and inclusion as tools for achieving excellence. So it is my privilege now to introduce to you Professor Wasserman, who will introduce the next award and its recipient.
So it's my pleasure and privilege to announce the award winner for the Student Award for Excellence in Diversity and Inclusion. And as you've already heard, here at OUWB, promoting compassion and humanism in medical practice is at the very center of what we do. And you'll hear that again and again over the next couple of days. And diversity and inclusion is no small part of that. Appreciating what diversity brings to ourselves and to our communities is a critical factor and at the very core of our mission here. And we recruit students on that basis. We specifically look for the students that reflect those values and that are going to contribute to that mission. And so you can imagine that the competition for this award was intense, that we received many applications and every one of them deserved to receive an award. Nonetheless, this year's recipient distinguished herself with respect to her contributions in the area of diversity and inclusion in both education, scholarship, and most especially in terms of service and leadership in her communities, both here at OUWB and beyond. So again, it's my great privilege to announce that this year's winner of the Student Award for Excellence in Diversity and Inclusion is Iman Dabaja. And now it's my privilege to bring back to the podium Dr. Angela Nuzzarella.
Each year, the American Medical Women's Association recognizes women graduates of all U.S. medical schools who graduate in the top 10% of their class. We have 3 recipients from the class of 2015. Alexandra DePore, Lauren Mecca, and Jacqueline Pastuski. I would now like to introduce Dean Christina Grabowski, who will be handing out an award for Admissions Ambassador.
Thank you. As I'm sure you can all imagine, students are really our best tool for recruiting the next generation of students to the Oakland University William Beaumont School of Medicine. Admissions ambassadors serve as advocates and ambassadors to the university, to our prospective students. They give tours, they answer questions, they give their personal email accounts, they eat lunch with folks on interview day and try to calm their nerves before they go into interviews, escorting them to interviews and the like. Today, I have the privilege of awarding the very first Outstanding Admissions Ambassador Award to a graduating senior who has gone above and beyond for the Admissions Ambassador program. Not only has she spent 4 years helping us recruit the next group, she has also helped us to train future ambassadors as they've come in, teaching them about tours at Beaumont and the kinds of ways to answer questions. She has exemplified for us service and leadership in her tireless volunteering efforts, and she has such a positive professional attitude. It's a joy to work with her and an honor to be able to award her today the Christina J. Grabowski Outstanding Admissions Ambassador Award to Melissa Basie. And now it's my privilege to introduce to you the Chair of Biomedical Sciences, Dr. Judy Venuti.
The Oakland University William Beaumont School of Medicine honors its faculty members each year for their excellence in the achievement of our educational mission. Faculty are recognized for their excellence in 4 areas: basic science education, clinical education, educational innovation and research, and excellence in service. The recipient of this year's Basic Science Educator Award is an innovative teacher in the use of technology and histology education. In her laboratory session, she engages students in peer-to-peer teaching that promotes both critical thinking and interactive learning. The 2015 awardee in Basic Science Education is Dr. Inaya Haj Hussain. Our awardee for the 2015 OUWB Clinical Science Educator is recognized for developing a highly rated neurology clerkship. She has been recognized by both students and other clinical faculty for her superlative skills as a clinical educator and for her genuine interest in her students. The 2015 awardee for excellence in clinical science education is Dr. Sunitha Santha Kumar. The recipient of this year's Educational Innovation Educational Research Award has not only produced an impressive number of peer-reviewed manuscripts in the medical education literature, but has also demonstrated innovative use of digital technology in his teaching. He has designed and implemented an iBook for the Medical Humanities and Bioethics course and employs a novel video-based assignment method for student oral assessment. Our 2015 recipient, recognized for his excellence in the areas of educational innovation, educational research, is Dr. Jason Wasserman. The 2015 recipient of the Excellence in Service Award has been a driving force in assisting other faculty in the development of their scholarly ideas and educational strategies. His role in faculty development includes the development and implementation of a medical education certificate program and his leadership in the Fellowship in Medical Education program. He has also been instrumental in developing peer evaluation for our faculty and in promoting interprofessional education here at OUWB. The 2015 recipient of the OUWB Excellence in Service Award is Dr. Stephen Loftus. And I'm bringing back Dr. Feldberg.
I hope that you feel the same sense of pride that everyone on the podium feels for the students and the faculty. It's really wonderful. And may I ask you to just, again, recognize every one of the people who have earned achievements today. I am so much looking forward to returning to this site tomorrow at 2 p.m. for the first convocation of this medical school. I know that many of the parents of the fourth-year students will be here, absolutely. But if you're a parent of a third or second or year student and you wish to come tomorrow, you're going to be in the area, please do come. We won't check a ticket, and if you want to see what your child will be experiencing in the next couple of years, please come to see this first convocation. And with that, I thank you all for coming. Congratulations to everyone. We'll see you tomorrow.